Hello everyone, my name is Kevin McLemore. Today I will discuss why counselors need theory and three specific reasons theory is important in the counseling profession. I will also discuss some ethical concerns that can occur when counselors become overly dependent on AI in their practice. The first reason counselors need theory is that theory provides a framework for understanding clients. Clients come to counseling with different experiences, behavior, relationship, cultures, and concern. A theoretical framework helps counselors organize this information and understand what may be contributing to a client's problem instead of simply reacting to the symptom. Theory helps the counselor ask why a problem may be occurring, what may be maintaining it, and what needs to change. The second reason theory is important is that it guides treatment and the selection of counseling intervention. Counselors should not simply choose techniques because they sound helpful. Their intervention should have a clear rationale. For example, a cognitive behavior approach may focus on changing unhealthy patterns of thinking and behavior, while a person-centered approach places greater emphasis on empathy, genuineness, and therapeutic relationship. Theory therefore connect what the counselor understands about the client with what the counselor actually does in treatment. The third reason counselors need theory is that it strengthens professional identity and clinical judgment. Counselors will encounter clients with very different needs, so they need a foundation of making informed and consistent decisions. Theory provides that foundation while still allowing counselors to consider each client individual circumstance. This becomes especially important when we consider the increased use of artificial intelligence in counseling. AI can certainly be a useful tool, but counselors should not become overly dependent on it. Grade 2024 discussed ethical concerns associated with integrating AI into counseling. One concern is that excessive dependence on the technology can reduce the human connection that is essential to counseling. AI cannot replace empathy, therapeutic relationship, and professional judgment provided by a trained counselor. Another concern involves confidentiality and accuracy. Counselors work with highly sensitive client information, so entering identifiable client information into an AI system could create privacy concerns. Harris 2024 also explained that generative AI can produce inaccurate information and introduce bias into client decision making. Therefore, counselors must independently evaluate information generated by any AI program. Finally, according to Fiore 2025, identifies ethical concern involving informed consent, confidentiality, fairness, professional integrity, and accountability when AI is used in mental health care. Ultimately, AI should assist counselors rather than replace their professional judgment. In conclusion, counselors need theory because it helps us understand our clients, choose appropriate intervention, and make informed client decisions. As technology continues to develop, counselors must remember that AI is a tool. The counselor remains responsible for protecting the client, making ethical decisions, and maintaining the human relationship at the center of counseling. I'd like to thank you for your time, and bye.